Assalamualaikum warahmatullah. Can we hear? Can you hear the voice?
Yes, we can, Doctor.
Okay, all right. Okay, we start shortly. Yeah.
Sure, Doctor. Should we start now, or do we wait?
You try your slide, see whether everyone can see your slide.
Okay. Can you see the slides?
All right. Okay. I think we can start.
Okay. Bismillahirrahmanirrahim. If everyone is ready, then we'll begin the session with the recitation of Kitab Al-Fatihah. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh to everyone. First and foremost, I would like to welcome Dr. Salehin for joining us tonight. So tonight, we'll be discussing about the concept of immunization, which is a very important topic in the pediatrics posting. So, yeah. So there will be 6 subtopics to be presented tonight. So the first 2 will be presented by me, which is the concepts of immunization, as well as the National Immunization Program. So my name is Afrina, and I'll be presenting the first 2. And then the next 2, the contraindications and side effects, as well as the additional vaccination, will be presented by Irdina. And then the last 2 will be presented by Brother Adib. Okay, so without further ado, let's start with the first part. So concepts of immunization. When we talk about concepts, we want to know the general concept of immunization itself, and then we want to know the difference between active and passive immunization. Lastly, we want to know the concept of booster. So let's start with the immunization concept. Now, immunization is basically a process by which a person becomes protected against an infectious disease, typically through the administration of a vaccine, through vaccination. So the term immunization itself is sometimes used interchangeably with the word vaccination or inoculation. Now, what's vaccination? Vaccination is basically the act of introducing a vaccine into the body to produce immunity to a specific disease. Now, from this definition, you might want to ask, what is a vaccine and what is immunity? So a vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease. So they are usually administered through needle injections, but can also be administered by mouth or sprayed into the nose. Immunity is basically the protection from an infectious disease. So let's say if someone is immune to a disease, that person can be exposed to it without becoming infected. Okay. Now we'll go to the active and passive immunization or immunity. So basically, when we discuss about immunity, we can classify it into 2 main groups, which is active immunity and passive immunity. Now, these adjectives, this active and passive, can be said to be referring to the body's immune response itself, body's immune system itself. So when we talk about active immunity, we say that the body's immune system is actively producing antibodies, whereas in passive immunity, the body's immune system, the body is given the antibodies, so the body is not actively producing the antibodies itself. Now, in active immunity, because because producing antibodies will require time, so the onset of active immunity is slower compared to passive immunity. But when we talk about the longevity of the active immunity and passive immunity, in active immunity, it is able to provide long-lasting immunity compared to passive immunity, which can only provide short-term immunity, which is around weeks to months. Now, in active immunity, it is not applicable to immunodeficient individuals, which makes sense because if for those who are immunodeficient, they may not be capable enough to elicit a proper immune response, whereas passive immunity, it is applicable to immunodeficient individuals. Active immunity can generate immunological memory. What that basically means is that when there is re-exposure to a particular antigen, the body's immune response, the body's immune system can quickly recognize that and can quickly elicit proper immune response, whereas in passive immunity, it does not generate immunological memory. Now, we've classified immunity as active and passive, but we can also further classify this active and passive into natural and artificial for each of this. So active, natural and artificial, and then passive, natural and artificial. So what that basically means is that when we talk about natural active immunity, so we say active, so the body is producing the antibody. However, when we say natural active immunity, the trigger that the body receives to produce the antibodies is of natural origin. So for example, infection with an actual disease. So that is naturally acquired. Whereas in artificial active immunity, yes, the body is again producing the antibodies, but the trigger to that response is of artificial origin. For example, vaccine. And then when it comes to natural passive immunity, so the body is receiving the antibodies, in this case, natural. So the source of antibodies is considered of natural origin. So for instance, maternal antibodies. So maternal antibodies via placenta, via placenta or via breast milk. And then artificial passive immunity. So the body is receiving antibodies, but this time it is of artificial source, so such as transfer of antibodies from animal to human. Okay, so that is active versus passive immunity. Now let's talk about booster. Now booster, from the word itself, we know that it boosts an effect, right? So in the case of vaccination, booster is basically an additional dose that is given periodically, which means after some time, to boost the immune response. So let's say in this diagram, so when there's first vaccination, the antibody concentration increases slightly. So this is the primary immune response, which is the first exposure to the antigen, and then over time it reduces, the antibody concentration reduces, and then upon second vaccination, the antibody concentration again rises. So this is the secondary immune response. It's faster, it's larger, and then when it decreases over time, that is when the annual booster is used, so that we can boost the immune response. Okay, so that is the concept of booster. Now let's go to the second part of the presentation, which is the NIP, the National Immunization Program. So this is the latest National Immunization Schedule. So latest that this was actually released 17th November 2020. I've highlighted and do some chonting on that because for the ease of my presentation, but I'll provide you the cleaner jadwal later. But basically, just to give you an overview, what is the update of this latest schedule compared to the previous one? The first update is the 6-in-1 vaccine, the 6 serangkai vaccine. And then another update is the pneumococcal vaccine. So we'll go through the schedule as a whole now. So at birth, there are two types of vaccine being administered. So the ones I've highlighted in yellow, which is BCG vaccine, intended for protection against TB, and then hepatitis B monovalent. So those are vaccines given at birth. And then we have the 6-in-1 vaccine, the vaccine 6 serangkai. So previously, it is the 5-in-1 vaccine. So it was previously it was DTAP, IPV, and HIV. And then if you're like me, then you might wonder, okay, where is the 5? This is just 3. But basically the 5 is actually in DTAP itself is targeting 3 diseases. Okay, so DTAP, D diphtheria, T tetanus, P pertussis. So that's 3. And then IPV, polio, and then HIV. So that is the 5-in-1 vaccine back then, 5 serangkai back then. But then in the latest schedule, the latest addition is the hepatitis B, which makes it a 6-in-1 vaccine. So we have DTAP, IPV, inactivated polio vaccine for polio, HIV, Haemophilus influenza B vaccine, and then hepatitis B. Okay, so we have so it's a 6-in-1 vaccine now. Now you may wonder what significance is this change? And you may wonder as well, what is the difference between hepatitis B in this latest 6-in-1 compared to the hepatitis B given at birth? To answer that, you need to compare this schedule to the previous schedule. So in the previous schedule, the hepatitis B is actually given at birth, at 1 month old, and at 6 months old. So if you can see my cursor now, I don't know if you can see my cursor, but in previous schedule, hepatitis B is at birth, at 1 month old, and at 6 months old. But in the latest schedule, only hepatitis B given at birth is still maintained, but the one given at 1 month old and 6 months old is how do I say, eliminated, but it's basically incorporated in the 6-in-1 vaccine now. So which in the 6-in-1 vaccine, it is given at 2, 3, 5 months, and then the booster will be given at 18 months old. And then you may wonder again, what is the significance of this change? So if you follow the previous schedule, in order for a child, in order for a person to be protected against these 6 diseases, there will be the person will have to undergo a total of 7 injections. And how do you get how do you get the number 7? So let's say this is the previous schedule, okay? So 1 and then 2, which is the one administered at 1 month old, 2, 3, 4, 5, 6, 7. So in the previous schedule, the child will have to get 7 injections to be protected against 6 diseases. Whereas in the latest schedule, in this schedule, the child will only have to get a total of 5 injections, 1, 2, 3, 4, 5, to be protected against these 6 diseases. So this is considered as something very significant because it enables to ease parents to follow the immunization schedule for their children. So there's lesser number of injections needed for this protection. Okay, and that's 6-in-1. So moving on, we have the measles vaccine for Sabah only at age 6 months old. Now, you may need to compare this one, the one in green, measles vaccine for Sabah, and the MMR vaccine, the one in blue, because measles vaccine only, this is given for those who are in Sabah at 6 months old, whereas this MMR given at 9 months old and 12 months old is given for all states, including Sabah itself. So why is Sabah receiving an additional measles vaccine at the age of 6 months old? because it is endemic there at Sabah. Sorry, my voice. Okay, the one highlighted in purple are the boosters. So I wrote here Darjah 1 because MR and DT, these are given at the age of 7 years old. So Darjah 1, if you remember, you're getting that, those shots. These are the shots that you've got. And then HPV vaccine, which is for girls only. Now this is given at the age of 13. I wrote there Form 1. And then another booster, which is tetanus vaccine at the age of 15, so Form 3, okay? And then in green here, which is only intended for those who are in Sarawak, which is the JE vaccine, Japanese encephalitis, at the age of 9 months old and 21 months old. And then another latest addition to this schedule is the pneumococcal vaccine, or PCV, pneumococcal vaccine. Now this is, okay. Pneumococcal vaccine is actually, it has been there as an additional vaccine, a vaccine tambahan, but it is only recently, not really recently, the previous government actually has wanting to list pneumococcal vaccine into the national immunization schedule. So the original plan is to bring it back in June 2020. Okay, back into 2020, but because of the whole COVID thing, it got delayed, it got postponed. So the new disclaimer is that this pneumococcal vaccine is expected to be given, is expected to be available late 2020 or early 2021. Okay, so this is a very significant this introduction, this PCV vaccine getting into the national immunization schedule is considered very significant because previously lower income, those who are of lower income and middle class are not getting this vaccine because they can't afford around 250 ringgit for this vaccine. So introducing this vaccine into the NIP, the National Immunization Program, so children are now getting it for free, is a very significant, and it will give benefits to our overall health. Okay, so this is what I've mentioned just now, the 6-in-1 vaccine. These are the 6 diseases prevented. So diphtheria, tetanus, or the layman term is lockjaw, kancing gigi, pertussis, whooping cough, or batuk kokol, poliomyelitis, hepatitis B, which is the latest addition to the vaccine, which is the update of the schedule. And then lastly, the Haemophilus influenza type B. Okay, so these are the explanation of the diseases. I won't go very deep to it. And that is all for me. So let's proceed with the next presenter.
Okay. So, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Irdina. My metric number 181110. So, for my part, I'm going to briefly explain about the contraindication of vaccine and its side effect, and also some of the additional vaccine that not included in national immunization program. Okay, so for contraindication and side effect, next slide. Okay, we have two types, which is absolute and relative. For absolute contraindication, which means here it is we must not a vaccine cannot be given to patients that have certain condition, and it does not present in all of the vaccine. Okay, so for any vaccine, there will be absolute contraindication in patients that have experienced severe anaphylaxis reactions to previous dose of the vaccine or to a component of the vaccine. And then under live vaccine, condition that is absolute contraindication is immunosuppressed children, those who are on chemotherapy for less than 6 months after last dose, on a prolonged course of high-dose corticosteroid, and then if given another live attenuated vaccine, including BCG, less than 4 weeks ago, and within 3 months following IV immunoglobulin and pregnancy. For killed vaccine, condition that is absolute that include in absolute contraindications with kill vaccine is severe local induration that involving more than 2/3 of the limbs, and also severe generalized reactions in previous dose. And then the next one is relative contraindication. So what does it mean by relative contraindication is which means we can give the vaccine to those patients, but it is acceptable if the benefit outweigh the risk. Which means here that precaution should be used when the drug or the vaccine are used together. So some of the conditions are those who experience moderate or severe acute illness. This include all vaccine. The risk-benefit decision will exist until the patient is considered recovered. And then the next one, for recent receipt of antibody-containing blood products such as MMR2 and varicella containing vaccine, except zoster, the risk-benefit decision exists for a predefined interval. History of arthritis type hypersensitivity reaction after a previous dose of diphtheria, toxoid, or tetanus toxoid vaccine. The risk-benefit decision will exist until at least 10 years have elapsed since the last tetanus toxoid containing vaccine has been given. And then the last one is progressive neurological disorder, including infantile spasm, uncontrolled epilepsy, progressive encephalopathy. So in this condition, the risk-benefit decision exists until neurologic status has been clarified and stabilized. Okay. And then the next one is specific side effect for specific vaccine. For the first one, BCG, the possible side effect that can occur include BCG adenitis. For hepatitis B, local reactions such as fever and flu-like symptoms can occur in the first 48 hours. And other rare side effects include erythema multiforme or urticaria. The next vaccine is diphtheria tetanus. The side effects include swelling, redness, pain. Sometimes small painless nodule can occur at the site of injection, but fortunately it is harmless. And then transient fever, headache, malaise, and including rare side effects such as anaphylaxis and neurological reactions. Okay. And then for pertussis vaccine, the possible side effects include local reactions, and it is severe if involving 2/3 of the limbs. Also, severe systemic reaction can occur, such as anaphylaxis, encephalopathy, high fever, fits within 72 hours, persistent inconsolable crying, and hyporesponsive state. The next side effect of vaccine in measles, mumps, rubella, MMR. For measles, transient rash in 5% of the vaccine can occur. Patient can have fever between day 5 to day 12 post-vaccination, and then URTI symptoms, febrile convulsion, encephalopathy within 30 days. For mumps, rarely transient rash, pruritus, and purpura, but pruritus in 1% of the vaccine can occur after more than 3 weeks of vaccination. Rare side effects such as orchitis and retrobulbar also can occur, and including meningoencephalitis, but it is mild and also rare. And then for rubella, rash, fever, and then lymphadenopathy, thrombocytopenia, transient peripheral neuritis, arthritis, and arthralgia also can occur as a possible side effect. The next vaccine is inactivated polio vaccine IPV. Also the local reaction that can occur is, also the side effect that can occur is local reaction. The next one is Haemophilus influenza type B. Side effects such as local swelling, redness, and pain soon after vaccination and last up to 24 hours in 10% of the vaccine can occur. Other minor side effects such as malaise, headache, fever, irritability, inconsolable crying, but seizure very rarely occur. For JE, Japanese encephalitis, local redness, swelling, pain, fever, chills, headache, and lassitude also can occur as a side effect of this vaccine. For human papillomavirus, HPV, headache, myalgia, injection site reaction, and so on. These are the side effects that can occur. You guys can read it. And then the next one is we want to know what is additional vaccine in Malaysia and its benefits. So the vaccine that is not additional vaccine that is in Malaysia, including pneumococcal vaccine, which is a conjugated vaccine. It is recommended to complete 3 doses of this vaccine within the first year of life, starting at 6 weeks of age. You have to also consult a doctor for the individual recommended schedule according to the age of the child receiving the first dose. For meningococcal vaccine, it is recommended for children that traveling to high-risk area, and even single dose of this vaccine already provides immunity up to 3 years. For rotavirus vaccine, it is recommended first dose to be given after 6 weeks of age. For this vaccine too, you have to consult your doctor for subsequent doses and intervals according to the manufacturer recommendation. For varicella chickenpox vaccine, in children that is 12 months to 12 years old, single dose is given, while for children that is above 12 years old, 2 doses of this vaccine is given more than 4 weeks apart. For hepatitis A vaccine, for children that is above 1 year old, 2 doses is given in 6 to 12 months apart. Okay, and then for the next one is benefits of vaccine. For cholera vaccine, it is indicated for those who are traveling to high-risk environment, to risk environments such as environment that have low sanitary conditions. So cholera vaccine is effective for 6 months in a single dose, which means it has around 85% protection. For influenza vaccine, it can prevent millions of illness and flu-related disease each year. It also reduces the risk of flu-associated hospitalization for children, and it can be life-saving also in children. And then influenza vaccine also is an important preventive tool for people with chronic health condition. For rabies vaccine, prevention for the people with high risk of rabies like the veterinarians, animal handlers, and rabies biology production workers. It also works as prophylaxis for travelers with a significant risk of exposure to rabies. The next vaccine, which is meningococcus, it is to prevent meningococcal infection that caused by Neisseria meningitidis. It is useful also for travelers that going to the sub-Saharan of Africa or to areas with current outbreaks. For rotavirus vaccine, prevention of diarrhea and vomiting that caused by rotavirus infection in infants 6 weeks and above. So this vaccine has two types that are available in Malaysian market, and both are proven to be safe and efficacious in preventing rotavirus gastroenteritis in young children. The next vaccine is pneumococcal vaccine. It can help to prevent pneumococcal disease that caused by those Streptococcus pneumonia strains that included in the vaccine. they have two types of pneumococcal vaccine, which are pneumococcal polysaccharide and conjugate vaccine. The next one is hepatitis A. It can provide a long-term protection against hepatitis A. It has two types, which are single and combined. Both of these are highly effective in preventing hepatitis A virus infection, but minimal side effect can occur, such as local reaction producing flu-like symptoms that lasting 2 days in about 10% of the recipient. For varicella zoster vaccine, prevention from severe varicella and its complication, and then it has a high percentage of effectiveness, up to 86% after 1 dose, and it increased to 94% after 2 doses. It also can be used for children in remission from leukemia for more than 1 year, but under supervision of doctors and doctors who specialize under pediatrician. And then for typhoid vaccine, which is Typhim VI, it is prevention of typhoid fever in adult and children that is more than 2 years old, and especially for travelers to endemic area, migrants, healthcare professional, and military personnel. So for this vaccine, booster is given every 3 years, same as another typhoid vaccine also, TYY21A, also booster every 3 years, and it is given with oral administration only of 3 doses with 2 days apart for adult and children that is more than 6 years old. Yeah, that's it from my part. Next one, I pass to Adit. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So I'll continue today's presentation with the controversy regarding vaccination. So to start, in today's world, everywhere people have their own belief, their own sources of information, and from these resources, they are gaining the information about the rare side effects of the vaccines, including autism, Guillain-Barré syndrome, and many more side effects. And people are also believing that vaccines are not necessary or lack of choice. They believe that vaccines do not work practically, and there are even to some extent, people are also believing that their child is not at risk, or that the vaccine preventable disease is not that dangerous, that not to be concerned about. And they also believe that it is better to be naturally infected than being vaccinated. And people today have their consent, and their consent overpowers everything, as they know what's best for their children. And we doctors are not the ones that are raising their children. And besides, they even have lack of trust in the government health authorities, the organized medicine, public health officials, and even pharmaceutical companies. Some of them even believe that the medical authorities are trying to rob them, extracting monies from the public with all the implemented medical obligations, with all the rulings and laws and such. Some of the beliefs are even relating to immunizations as a violation of God's will. They believe that if a person takes vaccines, it is as if a mere human trying to go against the natural infection. They believe in that people who take vaccines believe in vaccines more than God's protection. And there are so many more beliefs that are nowadays that are contradicting and causing the vaccination programs to be more and more difficult to obtain. Next slide. So how to tackle these anti-vaxxers nowadays? First of all, we have to use facts and evidence. We have to emphasize the existing scientific agreement on vaccine safety, for example, and efficiency. So by doing this, we can strongly influence people's attitudes towards vaccinations, because there are so many people that have that have knowledge. Nowadays, people are reading from across the web. They are reading articles from the social medias. There are too many info that they can get. So it is our duty, our job, to provide them with the true facts, the correct information, so that instead of them following what's there in the social media, they have a better resources, and which is more correct and the truest they can get. Besides that, we can also be a good listener, and by listening to their problems or to their complaint, we can find the roots of denial. By listening to these arguments also, we can analyze their shared structure, and we can prepare with fundamental knowledge on how to respond to certain criticism, to certain opinions, and more. And lastly, we have to emphasize the social benefit of vaccines. Vaccines have individual and also social benefits. If, like we all know, if enough individuals are vaccinated, then the herd immunity would be achieved. And with this herd immunity, we can protect individuals who cannot get vaccine because of their weak immune system, or even like Irina has mentioned, if they have possible allergic reactions to the vaccine. Okay, next slide. So according to the Mufti Wilayah, vaccination is considered as an anaphylaxis treatment, which abide by the phrase al-wiqayatu khairun min al-ilaj, which means prevention is better than cure. And vaccination also follows the maqasid sharia, which is, as mentioned, in hifzun nafs. And it is our duty to create a disease-free environment as much as we can. And we, as Muslim, we know what is best, and we should know what are the best solution, or what are the best steps to be taken to provide a better environment for the near future. Okay, next slide. So now we'll move on to the discussion. In this discussion, I'll focus on these two, which is a problem with dengue vaccination, and also the difficulty in developing COVID-19 vaccines. Okay. So the problems regarding dengue vaccine is that it lacks on the understanding of the pathogenesis of the dengue fever itself. There are several pathways that may be suggested, but the presentation on patients are not suggesting specific pathogenesis. And dengue virus does not naturally infect non-human species. Even non-human primates can sustain viral replication in relevant cell types, and they can even develop a robust immune response, but they do not develop any overt disease. So this matter will lead to the uncertainty of the dengue vaccination if it is tested on the animals themselves. Dengue virus requires such a complicated process to produce a live attenuated recombinant virus that needs to result in tetravalent antibodies. So this process would cause the time taken to produce or to achieve the best vaccine to take a longer time. And then the tetravalent antibody produced by the patient that received the dengue vaccines are susceptible to be neutralized in the subsequent dose given, as what has been documented in the clinical trial, which is done in Thailand, where the patients given with 4 doses of vaccines are the one that causes the initial dose to be neutralized. Okay, next slide. There are also some problems with the inactivated dengue virus itself, which first, it results in poor yield of antibody when introduced to dengue patient. And then it is cost ineffective due to the process of yielding the recombinant attenuated virus, as what I've mentioned before. And the virus has tendency to lose its virulence factor during the inactivation process. Then the next point would be the epidemiology of the 4 dengue virus serotypes. Due to the change of climate, travel, and urbanization, in some region, there were reported to only have 2 serotypes of dengue virus, which co-circulates in that region. But some regions, such as in America, they have all of the 4 serotypes co-circulating together. So this makes the vaccine production difficult, as the nature of transmission of 4 serotypes is unpredictable. And to determine the protective efficacy of the vaccine against all 4 serotypes would need multiple trial sites and also a lot of volunteers for a long period of time. And then according to WHO, the vaccine is protective against severe dengue for individuals with dengue seropositivity at the time of first vaccination. But the risk of severe dengue is significantly increased for individuals with dengue seronegativity at the time of first vaccination. If I were to be explaining a bit simpler, if you are infected with dengue previously, then the vaccine would be protective for you. But if you had never been infected with dengue, any of the 4 serotypes, then the vaccination would increase your chance of getting a severe dengue infection if you are to be infected in the future. And there was no efficacy against dengue virus serotype 3, and also data were insufficient to evaluate efficacy against dengue virus serotype 4. And this is according to up to date. Okay, next slide. So these are the reference. I believe the slides for the COVID-19. Oh, okay. I'm sorry for the technical error. Okay, so I guess that's all from me. Thank you.
Nothing to comment about COVID vaccine?
I believe that in today's world, even with COVID-19 being suspicious to the public, some of them even believe that COVID was a tool that was made in China for creating a disaster in today's world. And even the vaccination, which they believe came from China due to some major reasons. Even they believe that the fitnah akhir zaman they believe that COVID-19 is one of the fitnah akhir zaman, and the vaccines created are also one of the tools to control the human nowadays. There are a type of vaccine which was made in a patch type, and they believe that in that patch they have some kind of transmitter which can tell the vaccinated person their well-being to the government of China. So I think this is
sounds ridiculous, but some of you may also be some of believer. I'm not sure. So
Yeah.
any comments from the rest, or any question in relation to this presentation? I really hope that none of you, when you go to final year after graduation, and none of you will be like promoting anti-vaccination, because some of you may just be converted throughout the years. I really hope no lah. all these are common sense. Any question? Any question in relation to the presentation? You want to ask a question in relation to vaccine in general? All right. Okay. If no, then quite good. I think. Could the rep email me the slide? I'll give my email to you shortly. I think it's been quite a good presentation. I think hopefully this will just a recollection of what you've done in first year, second year. And please remember the new schedule. With the new schedule starting from December. Okay. Right. Okay. We end up with speaking for us. Assalamualaikum warahmatullahi wabarakatuh.
Thank you,
Thank you,
Doctor.
Doctor.
Thank you.
Thank you, Doctor.
Thank you, Doctor.
Thank you.
Sebenarnya dah lama dah perasan tak ada COVID-19 tu.
Kenapa kau tak ada slide ke?
Aku baru ya perasan.
Tak ada dalam Google Doc pun.
Tak, sebenarnya kita orang yang team slides tajuk tu equal follow yang past group punya tu. Aku tak tahu, aku rasa aku dah delete tapi macam aku terlepas ke aku sorry Dua Adib, ya Allah.
Tak apa.
Pandai
Sorry
goreng.
sangat. Nasib baik kau pandai cakap.
Tapi betul tau yang pasal vaksin patch tu. Even mak aku pun percaya dengan benda tu, yang ada transmitter tu. So macam dia bertengkar dengan adik aku sebab dua-dua punya pendapat pasal fitnah akhir zaman tu berlainan tau. Macam opinion mak aku ialah vaksin patch tu sebagai fitnah akhir zaman, yang mana WHO ni salah satu daripada puak yang nak take control of human kan. Tapi adik aku pula dia cakap yang apa yang mak aku percaya tu ialah fitnah akhir zaman. So macam diorang bertengkar-tengkar lah pasal COVID. Sedih lah.
Lepas tu hang try betulkan apa yang tidak betul lah. Ataupun hang dengar je.
Tak boleh betulkan lagi lah. Aku tunggu dulu.
Betul. Kita biar je.
Nanti bila dah keluar nanti baru kita explain.
Beradik spontan je.
Baik, Dik.
Baru nak cover. Aduh.
Aku dah terkejut. Dia slide tak ada. Terkejut tak ada. Okay.
Sweet, aku dah dapat number tu. Thank you.
Ada dua tu. IM tu. Doktor apa? Rizwan tak ada dua. Aku masa block 4 hari tu tersilap kontak. Lepas tu kena tegur dengan doktor.
Oh, tahu aku dah dapat.
Apa Doktor Rizwan apa tu?
Rizwan alias.
Kena check apa tu. Sebab ada seorang tu ada yang leave. Study leave.
Aku
check.
Weh, buka lah kamera.
Tak nak malu lah. Handsome.
Itu Zakran ke 10 esok.